intervention. At the end of the school year, a satisfaction questionnaire for parents has been proposed to all to the 38 first classes involved in the baseline survey, with a response rate of 59%. We are analyzing the collected data, and these results will be used to analyze the impact of our educational interventions on behavior associated with child overweight. Anyway, data of our survey, Occhio alla Salute, show that during the 10 years of our project, the trends of childhood overweight and obesity at the age of primary school children are not increasing in Modena. And this is good news. Thank you.
Thank you. Professor Branca, I don't know if you want to spend a few minutes talking about the retail index. I don't think we have your slides, but is there anything you want to share about that without your slides? I know you wanted.
Yeah, I mean, I think the important thing would be to understand what food environment means. And food environment means distribution of outlets, but also means what these outlets basically sell. So it's a combination of the concept of the number of outlets with the concept of food security, which is food and nutrition security. So we want to see that those outlets sell the right food. So that's something that's been revised several times. We need to have that good mapping in order to be able to establish targets. We want to see, okay, how do we want to change that food environment to make the offer of healthy food something which is there and affordable? I think that's really an invitation to everybody to measure that environment.
So I think I have 1 minute left. I just have a quick question, because quite often with food programs or any initiative, people who have jobs such as a mayor, they need to see big, exciting results in order to support these initiatives. And sometimes there aren't exciting results, or it takes a long time. Perhaps the mayor won't get reelected, or the people who are running these programs don't need the exciting results. They just need to see some progress. So how do you negotiate between the two of having a program that has success but may not have the success or the excitement that someone like a mayor may need to support this program? I think once you start to talk.
Is working, sorry. Well, actually, if a mayor believes in a healthy program, he knows, I think, that health needs at least 10 years of work if you want to have changes. So if you want to have changes in a very little time, you don't choose that theme. Healthy diet, healthy habits need long time. So I think that if you are responsible for your community and you think that health is one of your topic, you have to say it to the citizens and say, we are going in that direction, this is our problem, we need time, but you have every year to go on in the same direction. That's the reason why for instance, in Modena, we are going on with this project for the last 10 years. And after 10 years, we tried to measure, and we noticed that this increasing level that is in all Italy of persons that are obese or overweight in our city is chill. That is not so very beautiful. We have to say it's okay, we are okay. No, but it's a slight signal that we are going the right direction.
Okay, great. Okay, thank you so much. I wish we had more time. You were wonderful. Thank you. Wait, we have 5 more minutes? Oh, wow, I'm so wrong. This is wonderful. So we do have more time. And so I think it'd be great to hear from a mayor your response to this question.
Well, actually, in Holland, We're not directly elected, so that really helps a lot. So we're there for the long term, and I have a period of six years. And I'm supposed to be above politics, so I can't have my own political agenda, but what I need to do is see the energy in the political programs of my deputy mayors, who are chosen directly, and try to nudge it in and see if we can make a combination. So that's what we do.
Okay, great. Yeah, please.
Of course, if you want to show something concrete,
Yes.
you can, for instance, buy or build or renew a new cycle lane, because if you are talking about nutrition, as he said, it's a question of food, of environment, of safety, and it's also a question of activity, physical activity. Our children sit down all the time, so we need to do something concrete to let them out of the cars. So something concrete can be done in a very slight time, not only in long time. So something that is going to be perceived can be done, but the changes are long.
Right. Yes, please.
Yeah, I mean, I'd like to say that cities are really special for developing policies, because in cities you have multiple sectors working very closely together. So the complexity of the intersectoral work that you have at national level can be solved much more easily. Cities are much closer to the citizens, to the community. So you have that type of interaction. So we really look at the cities as an incredible laboratory for innovation. Let me give you an example. Sometimes even there's, as was mentioned this morning, a discrepancy between national and city policies, but that's not an obstacle. That's, I think, something which makes that debate even richer. The example I want to give you is taxation of sugar-sweetened beverages. It's been invented in a city. It's been invented, all the policies to reduce sugar-sweetened beverages have been invented in cities in the US. And the US is the single country which at the moment is, most strongly adverse to having taxation of sugar-sweetened beverages. So you see, even in the same country, you may have different views, but that's, I think, completely legitimate and very powerful, because cities can be the laboratory for innovation of the food system.
Great. I think we have like 1 minute, and because Dr. Branca has to leave, is there anyone who would like to ask him a question before he goes? Any audience question? Yes, please. If you could speak loud. Oh, she can. Okay. Not loud enough, though.
Hi, so I'm from the city of Birmingham, and recently our researchers from Birmingham University published a paper to say that interventions, school-based interventions, aren't halting the rise in overweight obesity. So we have a significant problem in the UK. I was wondering, through the work of the World Health Organization, so whenever we hear a city is managing to halt the rise, we're like, wow, how do they do that? Is it really through school-based interventions? Is there now a list of cities globally that are managing to halt the rise, or even, as Amsterdam says, they've stopped, or they're seeing a decline in overweight obesity? And is there some research into that too?
Well, certainly, particularly on the reduction of obesity, the only good news we have comes from local communities. You have certain local communities in France, you have certain local communities in Italy, even in the US. I'm not sure about the UK, but I also think you have some documentation of some interesting cases where the epidemic of obesity seems to be subsiding because of city intervention. So I think that's where the hope is. School interventions, they're working or not working? Well, yeah, it depends. If a school intervention is based only of some occasional nutrition lessons, maybe, it's possible they're not effective. But if you have an intensive intervention, if you have school canteen at the same time, if you have a reduction of marketing, if you have the involvement of the family, then I think the likelihood to be successful is much higher. So it depends on how these interventions are done. It depends on the scale of the intervention. It depends on the involvement of a larger community. But certainly The good news is that we can fight obesity, and basically the good news comes from local communities and some smaller cities.
Yes. Anyone another question?
Hello. I share my time 50% in the urban, 50% in the rural. And although the rural, and specifically in the Alps, actually in Italy, in Valsesia, and just from observation, the rural kids are not obese. They're active, they live near farms, they actually farm themselves, because most houses have their own garden and they're doing their own farming. They're eating very good, high quality, fresh, not processed food. And they understand the difference. The city is, I think, where there's simply, they don't know the source of food, they don't have much contact with nature, and therefore they're buying in the supermarket with the cheapest price or whatever they can get. Some people, okay, not everybody. And I think there's an opportunity for cooperation between urban and rural, to exchange, like programs that send school kids to agritourism, for example, farms for a few days, to get introduced to nature, to livestock, to farming, to processing food, and to eating really good quality, healthy food. And once they experience it, not looking at slides, but experience it, eating it, and working there, I think they will go back to their city and they will start demanding from their parents a change in